Good day, everyone. This is Hady Lichaa. I'm an interventional cardiovascular specialist, and I have the pleasure of having Dr. Michael Levy with me. And he is a vascular medicine expert, very active at vascular medicine societies and Society of Cardiovascular Angiography and Interventions. It's my pleasure to have you today.
Thank you for having me. It's fun to be here.
So I needed to kind of pick your brain and get your advice on kind of starting a vascular medicine program for the folks who are early career physicians. And it seems like you have a very successful training program. So tell me about your background first and how you got into vascular medicine.
Great. So I originally did the majority of my training in Canada. I'm Canadian, go Canada. And there I was fortunate to have a number of mentors, one of whom was a woman named Dr. Sonia Anand, who had recently, at the time, come back from Boston, where she had done training in vascular medicine at Brigham and Women's Hospital. She set up the first vascular medicine clinic, I believe in Canada, at McMaster University, where I was as a cardiology fellow. And so I was fortunate to get to work with her and learn from her. And the more that I saw, the more I was interested, because this really was a very new field in Canada at the time. I also had a big passion for the cath lab and for procedures. I'm sure you can relate, and just couldn't get that out of my head either. And so I was doing training in Canada in coronary intervention. And one day I happened to step into the elevator and Sonia was there as well. And we had a conversation, and I had told her about some of my plans and that I was hoping to get some more advanced training in intervention. And at the time, Canada really didn't have a lot of extra training beyond coronary intervention. And so as we got to talking, she had suggested that given my interest that I'd had with her clinic and with vascular medicine, and also with something advanced, that perhaps I should look at the program at Brigham and Women's Hospital that also featured training in vascular intervention, vascular ultrasound, and the whole bit. This was such an exciting idea for me, because really at the time in Canada, none of that existed, certainly not as a cardiologist. And so that elevator conversation had led to a plane ride and an interview at Brigham, and the rest is kind of history, I guess.
That's awesome. Thank you for kind of giving us a background. I also know that you established a very successful program. So who are the key players in your program, and why do you think your program has succeeded so far?
I think I'm very fortunate where I am at Lahey Hospital Medical Center in the greater Boston area, that I had come to a place that really was one of the pioneering places for vascular medicine very early on. And in fact, the very first presence in our department back when it started in 1980 was vascular medicine. And so there's been a long history here of it. It's taken a number of different forms, and I think as the field has grown, it certainly has meant different things. But at least I was fortunate that people knew of the term, and it had at least a certain brand to it when I arrived. However, when I arrived, there was basically myself and one of my other colleagues. And so it took us a lot of work to really rebrand ourselves and tell the institution what it was that we did and the scope of what we did as well, because we had both trained in modern vascular medicine programs. I was fortunate to have a buy-in from my chief as well to really expand and grow. And we found that what made it really successful really was just talking to our colleagues, talking to people, seeing what they wanted, where they needed help. We really found that there became a niche for anticoagulation. That was something that was really underserviced in our hospital. We partnered with vascular surgery and interventional radiology and discovered that the vein care really needed a bolstering. And so really by forming these relationships and these partnerships, we were able to grow and offer new programs. Additionally, we had the support of GME, and we're fortunate 4 years ago now to reboot the vascular medicine program. It had a training program. It had existed in the mid to late 90s, and then as all the research and funding cuts happened, it fell away. But by the time we had brought this back to the GME, the institution really understood the importance of our presence and the fact that we needed to have a future, and that future meant being able to train people. So I think we've been fortunate in a lot of ways, and we've continued to grow and are keeping at it.
That's great. And do you think a multidisciplinary conference, vascular conference, is actually helpful for program growth? And do you recommend that?
Absolutely. I think that really is the main message that I say to as many people as I can. I think this era where there are so many different potential treatments for vascular disease and so many players involved, it really becomes much more about focusing on the patient and making sure that they get the best care possible. And what that ends up being, hopefully, at an institution is leveraging all the skill set and expertise of those that are trained and have interest in these areas. And so a great example for us is our vein center. Our vein center is in the region the only tripartite effort that I can think of in which vascular medicine has a big stake, vascular surgery has a big stake, and interventional radiology as well. And the three of us together have been able to form a greater whole. What's also fantastic about that is that really gets the institution interested, involved, and much more willing to support endeavors that may require funding or outreach. And so that really has been a nice model for us at our institution. Instead of working in silos, we've been able to partner together and have been able to roll out a very robust program.
That is phenomenal. And obviously, some of this is related to policy within the institution, to politics, local politics, and personality, of course. You know, you need someone who collaborates with other specialties like yourself. Now, tell me about the challenges that you face from both a practical and academic standpoints with regards to the program building aspect.
I think you basically described it as you're talking about the politics, personalities. What else had you said? Obviously, we're all people. And
policies, yeah.
That's right. None of us are perfect, and it depends on which side of the bed we roll out of sometimes. Again, I would say the challenges are similar to the successes. The challenges do also come from interfacing with multiple specialties and trying to gain consensus. One area now that we're really trying to work on is we had established a very robust PERT program and have run that for many years at our institution. It's probably going on about 10 years now. And the way it was run mostly was run via vascular medicine, interventional cardiology, doing a lot of the procedures. We've now had some newer members of the IR team who had come from elsewhere who are quite experienced in PE interventions and in lower extremity interventions that really would like to participate. And so we're really trying to find a way to make that work so that we can actually both help our other colleagues professionally, you know, meet their goals, but also still focus on high quality patient care as well. So we've had a lot of meetings in that regard. And I think my North Star, as mentioned, is I really am trying to foster collaboration and seeing how we can make this work for all of us. But, you know, it's a challenge sometimes to try and revamp a program that's already been doing well in order to include other players. So we're certainly working on that, and that requires meetings at all levels, including the system level. So again, I think as long as you can talk to people, certainly Zoom is fine, but even being able to meet someone in the cafeteria for a cup of coffee face-to-face seems to do so much more than Zooms and emails. I think that's what I'm being reminded as I'm coming out of the COVID era. So I just think, you know, communication and talking to people is the number one thing, and eventually things will work out if you stick to those principles.
Absolutely. And, you know, finally, for early career physicians who are starting programs, and just give us some advice on how to actually engage other specialties and engage administration with regards to the positives from both the patient standpoint and also the business of medicine standpoint.
Absolutely. So vascular medicine is such a new field that I constantly have people that I mentor that are going out into the workforce. They're going to places, perhaps they've trained one place and they live, where they grew up as somewhere else. And they may try to approach those hospitals that have had no program whatsoever. And so I think for me, part of it is understanding the market you're trying to enter. So for the ones that have no vascular medicine presence whatsoever, I've encouraged people to really meet with some of the leaders of the hospital or departments if they're going to be housed in cardiology. Sometimes they'll be housed in vascular surgery even, and really understand what the skill set is and what someone can bring to the table. I can think of one person who was a mentee who really needed to find a job in Dallas where her husband was training, and she actually was able to approach a vascular surgery practice that was quite successful and really help them to understand how they could form a partnership. And now she's doing phenomenally well and also helping them with their vein program, their imaging. And so she really did a good job of understanding the market and selling. I think in places where vascular medicine is more of a presence, it can be a little bit easier because people understand what that is. But even there, what I often say to people that I speak with, especially ones that also are trained in vascular interventions, not just perhaps cath lab or fluoroscopic based interventions, but also even endovenous procedures, that although it's great that you're trained in this procedure, I firmly believe that the most important part of starting a program actually is not the procedure itself, but everything around it. The buy-in from the institution, the referral base, letting primary care, internal medicine, whomever know that you are there and you can refer these patients. Having some place to work up these patients, a clinic, doing the procedure, having some place to follow them afterwards, and just making sure it's a very closed loop that is very patient-centric. Because I think if you can do that, the program will be successful. The times that I've seen programs fail is where someone brings something to the table where they say, yes, I can do this procedure, I'm going to do it, but the whole institution is not ready. The infrastructure is not there to support it. And that becomes a much more difficult endeavor. So I think having patient care as front and center and trying to cover all aspects of that, you'll have a great program and sleep well at night, hopefully.
That was phenomenal. I really appreciate your time. I'm sure a lot of listeners are going to be listening to you and hopefully getting in touch with you through the society and, to get their programs going. And I'm sure a lot of hurdles are in the way, but with the collaboration that you have exemplified, I think this has a hope. And I think there are so many patients out there that are in need of vascular care that there are not enough physicians, honestly, in all specialties take care of them. So if we can kind of spread the net as wide as possible, we'll be able to help a lot of folks while respecting each other's specialties. So thank you very much for your time. And
thank you. Always fun.
All right. Thank you very much.
Take care.
Have a good day.